68 students and the 5 teachers in Bahati Girls Secondary School have tested positive for COVID-19. They are in isolation. 115 students are already in quarantine within the school. One student who turned positive on COVID-19, yesterday he developed a complication. We evacuated the student to PGH isolation. And I want to inform the members of the public that the student is already in stable condition and is out of danger. I want to assure the parents and also the members of the public that they should not be worried because the girls are in stable condition. The other issue is that the whole population of the school is only 75 members who have turned positive. That is 5 teachers, 2 supportive staff, and 68 students. And we want to say that a team from Bahati is already on the ground, and they are helping or they are managing the situation. We have been doing what we call the target testing in Nakuru County. And the Bahati Girls was one of the schools that we did target testing, and therefore that's how we came to get the number, the 68 students that turned positive. When it comes to Nakuru County, immediately when the school were told to reopen, we formed teams and we zoned this county in 11 zones. We have 11 teams that are moving from one school to the other. And what we are doing is that our team is going around all the schools in the county. And once they are in those schools, they can decide to test any school at random. We are doing at random so that we can know the transmission within the schools. We have tested more than 27,000. And out of the 27,000, that's how 3,000, the total number of the people that have turned positive in Nakuru County is 3,062 since March this year. 1,508 who are already in home-based care, and the 1,026 have already recovered. The number for today is that we have only 34 patients within the hospital. That is 13 in VGH, 5 in Naivasha Hospital, 3 in Lagalaga Isolation Center, 1 in Annex Hospital, and 12 in Nakuru Nursing Home. After turning the school to be an isolation center, it will be a quarantine center and also an isolation center, quarantine and isolation center. It is a better method of managing this COVID-19 because if like now we decide to close down the school, it means that all the students will now spread the diseases to where they are coming from. And therefore, when we are managing them from that school, it will be a better way of managing the problem. One of the way when we are managing what we call infectious diseases is managing the disease from the source instead of spreading the disease. And therefore, we have turned the whole institution as an isolation center. We have suspended the training, the running, so that we can be able to manage the cases.
COVID is here. COVID is now at the community level, and we've seen an increase in actually COVID cases, especially in our county, because we've actually increased surveillance. We've increased the number of tests because we want to go by the WHO protocols, and we are now doing almost 2,500 per week as opposed to the 1,000 we were doing, and you've seen the numbers have actually gone up. I want to say that there's a school in one of the schools around here that registered a very huge number of children who had actually COVID-19, who tested positive to COVID-19, about 68 of them, and about 115 actually on isolation. There's only one child who developed some complications and is being treated at Nakuru Level 5 Hospital. But we want to urge each and every one of us to continue observing all the MOH guidelines so that we avoid the problems that we have. But I must say, we've enhanced by 3 times the number which we normally do, but that's not enough. We need to do more, and we need to urge the communities where we live from to continue observing distance, to continue washing their hands so that we avoid this problem that we are seeing. The school is not closed. The school is on, the students are actually in quarantine in school. So they are quarantined, about 115 of them. The 68 of them who tested positive are in stable condition. They have no problem. It's only one child who was brought to Nakuru level 5 who developed some complication, but the rest are